Why is there a crease in my areola following gynecomastia surgery? Full disclosure, this is not of my patient. This is a patient who has got in touch asking for help maybe not a couple of weeks or so ago. Amy showed me the photo and said, look, really, really want to help this chap. And I said I couldn't help because one of the problems with surgery in general, but particularly with gynecomastia surgery, is kind of you're fighting against scar tissue, and you can do too much. And if you do too much, you can get contour irregularities and dents. And this person had quite an obvious crease underneath the nipple where there'd been over resection. And I can understand it. It's a difficult operation, gynecomastia, because there's kind of always a tendency to over resect, because patients usually the complaint is, oh, you've left some behind. Personally, I always leave a couple of centimeters behind the nipple, even though patients say, get rid of it all, I don't want it. And they might say, oh, it's still lumpy behind the nipple, but it looks good. If you take away too much, particularly behind the nipple, once you start getting that crease, even worse, you can start getting the nipple sitting in a kind of dent, in a crater deformity, they call it. So that is something that is very hard to fight against, because you're fighting against scar tissue, and scar tissue, when we do surgery, all we do is create scar. That's all we do. So how do you get rid of a scar? By creating the scar. Anytime any surgeon touches you, they create scar. So it's extremely difficult is the answer to that. Monica's, look at that, Monica. God, just as I thought I was one of my own. Monica's thank you, Monica. That's jolly kind of you to say that. Just when I was in a slump there, and Monica's built me up. Thanks, Monica. Yeah, so it is very difficult to get rid of a crease, and it sounds absolutely unhelpful, I know, to say it's better to do it right first time. I know that's really unhelpful to someone who's got a crease, but one of the problems with surgery is revision surgery is really hard, and that is why it is very difficult, certainly in my practice, when people contact us who've had surgery elsewhere. Many surgeons will not be that keen to kind of take on problems, because they're always more difficult to fix than the original surgery. So, doing a gynecomastia, doing a breast augmentation, breast reduction is difficult enough, but doing one where they've got problems, particularly if you've got problems with scarring, too much taken away, things like that, really difficult to treat. Always best, as I always say, to go to the regional surgeon, because they've got an vested interest. And sometimes, like in this case, the risks of kind of doing something outweigh the potential benefits. So in this case, I just couldn't help. It sounds bad, but I couldn't help, because I'm worried about making it worse. That's the thing. Whenever you do surgery, you can make things worse. So yeah, it's a tricky